I'm Dr. Derek Masden, and I'm a plastic surgeon specializing in hand surgery at MedStar Washington Hospital Center. Since I was a child, I always thought I would be a doctor. I was in medical school, and I didn't know what I wanted to do. I got to the operating room the next year, and I loved to operate. And I had some great mentors in the operating room, and I thought, this is it, I gotta be a surgeon. You can be impactful every day, instantaneously. It was fun, it was creative, it was problem solving, and so that's where it started. I like being able to return function to people. I like being able to take something that's broken and put it back together and make it whole again. You know, particularly with hand surgery, I think we underestimate how much we use our hands. I mean, it's easy for somebody who's a surgeon who makes their living off their hands. But I think most of us don't realize that the 99% of the way that we interact with the world is through our hands. We are the #1 trauma center in town, so we get a lot of traumatic injuries that oftentimes after the orthopedic portion or the surgical portion is done, they need the plastic surgeons to come in, clean things up, get coverage. When hand surgery first developed as a field, it was a group of people from different disciplines that were all doing different things. The neurosurgeons were taking care of the nerves, the orthopedic surgeons were taking care of the bones, plastic surgeons taking care of the soft tissue. And finally, you have these forefathers or the people that introduce hand surgery and come up with the idea that, hey, listen, this is something that one person should be doing. I'm lucky enough here that I do get to work with residents, both plastic surgery as well as orthopedic surgery. You know, it's one thing to be able to do something well. It's another thing to be able to teach other people how to do that well. I think the nicest thing they've ever said is when they don't say it, when they, give you a hug and they cry. And that happens in the hospital, and it can happen in the office. But I think when you realize, when you get to that point that's beyond words and it's just pure emotion, that you've touched somebody. And if you've been able to impact somebody that way, I think it's pretty important.